go. I was just trying to.
Wonderful. Thank you, Gariana. Good morning, everyone. Thank you for attending the Community Advisory Board Subcommittee for Policy and Budget. Today is Monday, November 18th at 10 a.m. We can start with roll call. So for CAB members, Justin Van Zerber, West County Chair of Policy and Budget.
Mhm. Nicole Green, East County Chair of CAB and member of Policy and Budget.
Awesome. Staff on the call.
Good morning, Gariana Youngblood, Office of Reentry and Justice.
Wonderful. Individuals in the room?
Cynthia Zavala with Center Force.
Great. And those on the call?
Good morning, Annette Corvo, Center Force.
Susan Woodhouse, Public Defender.
Wonderful.
Jill Ray, Office of Supervisor Candace Anderson.
Wonderful. Thank you all, and thank you for being here this morning. Second is public comment for any item under the jurisdiction of this committee that is not on the agenda. Staff or committee members first. Do you have anything?
Thinking. Let me look at my. No, sorry, my brain is not. But I don't believe so. If I do, I'll come back.
Okay, staff and any members of the public. Awesome. Hearing none, we can move forward. Consider approving the minutes from November 14th. Is that the right date, Gariana? No,
It was
October 14th. Okay.
Yeah, that's correct. It should be October 14th.
Thank you. I can make a motion to approve the minutes.
And I will second the motion.
Great.
I have a motion. I have a second. Justin,
Yes.
Nicole,
Yes.
motion carries.
Great. And are all four things from number 8 in today's budget? We have share RFP from H3, discuss the learning disabilities comment, budget proposal cover letters in, and then did we follow up with Jody on the number of in custody, Gariana?
I didn't get a response, but I can reach back out to Jody and figure that out.
Okay, that would be great. Thank you so much. Any questions, comments on that?
Which one?
Just on the previous agenda.
No, I don't have any.
Great.
I do know that Jody will be coming to programs and services meeting
Okay.
because they had, so I will get that up. I had to think for a second to get caught up, sorry. Programs and services did have a meeting, so they did look at the survey. They had really good feedback. I really appreciate the new members because it's a brand new look at it.
Yeah.
So they brought up some really key points, especially to ask Jody. So I was told that Jody's going to come to their meeting
Oh,
on
that's
Thursday.
awesome.
So that question that you have may be answered. They had a lot of questions. And I should have brought it with me, but Tiffany has been taking notes and she just jumped right into chair and is doing a great job. So I like the angle that they're taking. They have questions that I would have never thought of. So it's good to have that fresh eyes. And we did look over everything and I gave them the feedback that we had from our meeting. So I am going to join their meeting on Zoom on Thursday and then I can bring those comments and stuff back to you at our next meeting from that.
Awesome, great. Update from the Board of Supervisors.
So I am excited to say, it was a really great meeting. It was a long meeting, but really great meeting. And from our, of course, we were there with the GI Coalition and EHSD, and I appreciate them for allowing us to present. And the Board of Supervisors, did give them some feedback on what they need to do, but in reference to us, we have received the green light. Now, the thing that we need to work on is they do want us to, I'll just say this matter. They're still on the fence in reference to just GI being the standalone, which I already kind of figured that. So the recommendation is to collaborate with EHSD in reference to being tied to EHSD in some way. And I'm being very transparent and the feedback I'm giving yet because there's a meeting coming up. I did request to be on the meeting with Marla to talk about what that looks like, because before the GI meeting, she did provide some information in reference to how this could tie into EHSD and probation. And I gave a couple of recommendations based on what we talked about, but that was just before that board of supervisors meeting. So I wanted to be able to come back to the table with her to talk about what that would look like. And also maybe we have some ideas that we want to bring, because from a CAP perspective, we wanted to really uplift GI, right?
Mhm.
So I wanted to figure out how do we want to go about this. I want to make sure that we are still meeting the needs of this population and understanding where or which angle the board of supervisors are going to go with this. They are going to want to tie to something. So in the sense, it's kind of not going to look like GI. So how can we, take the data that we receive from the coalition, Rachel, as well as knowing what's expected of us, and make sure that we still uplift the justice involved population and what the CAP wanted. Because it's going to have to be tied to EHSD CalWorks program in some kind of way. Does that make sense? So we are now asked to come back to the next step, and we are now to write out what this is going to look like, and it needs to be tied to some type of programming. So so a little bit of feedback on what Marla presented to me before the board of supervisors meeting is my recommendation was this. The focus was on just the CalWorks specific. Some of those are already receiving CalWorks, and how do we uplift individuals to make sure they're signed up for CalWorks? That's great and all, but there is a certain group of people that are just as involved that I feel could benefit from like that one-time funding. So my recommendation was there are some individuals that they should sign up for CalWorks, and sorry, this is not typed out, but it's a small group of folks where they're caught in the middle. Those individuals where they come out of incarceration, they get on CalWorks, they end up getting some kind of employment, and now they're off. And now they're stuck in the middle where I don't qualify for it and I don't have enough to be able to sustain myself. In my opinion, those individuals could probably still benefit from having some type of one-time or supplement to be able to get them on their feet, and then they would still be tied to the CalWorks individual and be on probation. Now, what that looks like, haven't been in more detail, but listening to what she was presenting, that was my recommendation, was we need to figure out, we can't serve everybody and we know that, but what part of this population could we actually serve the best and probably get a better outcome? And that was just a thought that I had, because honestly, I was one of those individuals to where I could have used something like that to help me. I qualified for CalWorks for a very small time, and then it was cut off because I got a job at $15 an hour.
Yeah.
And then I was homeless. So that could have helped me prevent myself from being homeless and have that leg up until I was able to get a job to sustain myself. So that was the first thing that came to me. So I figured we can kind of have that kind of discussion. I have a meeting on December, one second, I think it's the 6th, because I want to make sure I bring back your input along and it's not just me talking. I think it's, one second. I'm just looking at my calendar real quick, Garyana.
So the Board of Supervisors wants us to make a recommendation to CCP or to the Board of Supervisors?
Well, I'd always have to go to CCP first and then back to the Board of Soup. So they're asking for us to come back with our outline plan of what it's going to look like, meaning when we're working with EHSD, what population, how many, that next step of mapping out how we're going to
They
the
want
program.
us to do this, or they want EHSD to?
They want us to collaborate with EHSD. So it won't be us actually typing out, just we're working with them to be able to give our input for it.
Got it. Okay.
I would have been way more prepared for you.
So, but then the next step is just you're gonna meet with them, and then they're gonna make a recommendation to CCP.
Well, no, it's going to be combined together. So we're going to make our recommendation from CAB based on our discussion with the HSD. So what I asked for after the Board of Supervisors meeting is I asked to meet with Marla, because the meeting that we had was really quickly.
Yeah.
So I wanted to revisit what we discussed, and since the Board of Supervisors want us to collaborate with her, we've never sat down and had that conversation.
Yeah.
So I requested for a meeting so that we could figure out what that looks like, what is her goal, her plan, and then tie it into probation, and what that will look like for them as well to map that out, because we're going to be collaborating with them. So
We both can't be on that meeting. Can she just come to a policy and budget subcommittee meeting?
I don't know if we both can be on that meeting or not. She probably can, but I was trying to get it scheduled.
Go ahead, Rachel.
Thanks. Can you hear me okay?
Yeah, of course.
Yes.
Okay, great. So I was just going to add that the direction was for the CAB and also the GI Coalition to work with Marla on this. So it's not just the Community Advisory Board that's providing input. It's the broader GI Coalition. Because if you remember, the allocations are separate, right? One is the Measure X allocation, the other one is the AB 109, but the board direction kind of recognized that the broader coalition was well informed about guaranteed income, design, implementation, evaluation, and all the different parts, and so wanted that to be included in the discussion. And EHSD has been in touch with us regarding the way that they're drafting a plan. And so I think it's good that we kind of all are, rather than segmenting off, I think it's really good for us to stay in communication with each other and keep one another in the loop and keep having a conversation around this, because there, this is a complicated program to design, and we want to do it right. And I'll also add that there are a variety of stakeholders outside the county, as I've noted in previous meetings, that are already running pilots or have run pilots for this population that have a lot of wisdom and best practices to share. Santa Clara County's pilot literally just launched last week, and I have a meeting with their administrator at 11 this morning. They are happy to come and talk to people in the space, to attend a meeting, to share their learnings, to have a smaller meeting. A friend of mine running the pilot in their second cohort in Gainesville is also interested in sharing learnings. So I think, I just want to keep urging that we are inclusive in our conversations around this and be open to learning from how other counties and cities are implementing the pilot.
Yeah, thank you for the feedback. And I think we align with you, Rachel, and I appreciate the context as well. Do you have a recommendation on how you envision that kind of thought space to move forward together? And do you know if there's a timeline that EHD wants to make this recommendation? EHSD, sorry.
Can I respond, or I can't see the room?
Yeah.
Okay. So EHSD has sent a message wanting to bring this item back to the board, suggesting that the item is brought back to the board at the end of January with a draft plan sometime in late December. I think that we want to meet with EHSD on the sooner side of things to determine whether that's a feasible timeline. And whether it's enough time to gather resident input and also, like I said, input from other stakeholders running pilots in other cities and counties. But that's the proposed timeline on the table. And I think, our coalition will be meeting with Marla soon, and it would also be great, again, to just be inclusive for everyone to be able to be in the room to have the conversation and figure out what would work best in terms of a process. I think, one of the biggest things to figure out in terms of the population is what the time to release. So there's pilots that have said, anybody released, for example, the Durham pilot, Durham's Excel pilot, anybody that was released within 60 months, so 5 years, was eligible for that pilot. Whereas other pilots have a much smaller 12-month window in time of release, Santa Clara County. And then there's kind of everything in between. So that's one of the, that's a specific design decision and a population selection decision that people, that you all and everyone should think through regarding how to contour that population. Because of course we know with a $1 million allocation, there's only a specific number of individuals that can be served with the pilot. And then really nailing down the payment amount per month. The proposal on the table is $1,000 a month. Is that the go forward amount? Is 18 months still, the go forward duration that people align around? So there's just all these different parts that I think it's good to put them on the table and figure out when and what kind of input can take place. And like you mentioned, Justin, like who can be in the room together for these conversations because of the Brown Act, I think is another piece that, has to be figured out internally.
Thank you. And Rachel, do you have that your meeting scheduled with her?
We do not. We're going to schedule that this week. Initially, we had thought to meet before the Thanksgiving break, but that may or may not be possible. So if that's not possible, then it would probably, we're going to target early side of December.
Thank you. Okay. With that information.
So one of the key things that we were, and thank you for that information, Rachel, because one of the things that we were waiting for, and I know I was asking Patrice, what was the deadline for us to go back to the Board of Supervisors? So I was unaware, needed to give it back. And for me, I was following the same step as Rachel, was trying to get a meeting set with Marla, which I have for December, just to kind of get an idea. I needed that information that we talked about because I didn't have it. So I can bring it back and present it to you. But for me, I wanted that information and kind of like what Rachel just said, kind of talk it out with you and kind of figure out, do we want to invite individuals here that already have the pilot? If there's already meetings that's being put in place, join those meetings as well. Who can and how we have split this up between me and you, because I don't think we can both be in the same meeting due to Brown Act. So how will we go about doing what?
I mean, can she just join your December 8th meeting?
I don't know. I have to go back and ask that question. So this was set up to discuss the cab and for me to get the information that was presented to me for the Board of Soups, because I wanted to be able to show it to you.
Yeah.
So I don't want to kind of just talk at you without it being visually in front of what she shared with me to get your feedback. And then how do we make sure that we stay in a loop for the meetings that Rachel is having so that we can decide who joins what to be able to bring that together? Or can we just be a part of that as well? So for me, step one was getting this information from her and getting the idea, because what Rachel was saying, I was unaware of that.
Yeah.
So I've been reaching out just like her to be able to get a meeting to kind of figure out what our next step is going to be, because the data that we have is what Rachel presented. So do we want to take that information and collaborate and kind of, put together something from that? Or I wanted to get an idea of what EHSD was proposing, so that we do have a voice in what they're proposing. At the end of the day, we can propose something and then it goes up front and it gets changed.
Yeah.
So I wanted to make sure that we uplift what we really, what we want, what we've all talked about, have an idea of what EHSD is presenting, have our voice in that as well. So whatever happens at the end of the day,
Yeah.
we can still make sure that the population gets something, because at the end, they can make a decision on how they want this to be mapped out. That's my honest opinion, how I look at it. Let's submit what we really want and recommendation on what she's submitting, and really advocate and go with what they choose. The coalition did a really great job. It was a great meeting. We was there. They had it was a movement. I've learned a lot. A lot of individuals came to talk about GI. There's current pilots. Very happy that Santa Clara County pilot is actually up and running. And the good thing is we're doing an 819 summit with them as well. So how can we get there? If we decide to do another work for something and bring some folks back, maybe that's one individual that we can bring back to kind of figure out what theirs look like. So, but I wanted to present you with what she had to get your opinion on that. I don't really have too much to put in front of you outside of what we already received from Rachel. So I want to, do we want to move forward and try to come up with an idea from that, and then my meeting's on December the 10th.
I think you have to meet with her first.
Okay. And then I can bring it back to the December.
Yeah.
And Rachel, when is your, I think you said you have some coalition meetings, or is it the one you're waiting with Marla?
No, we have ongoing coalition meetings every week. We have, our next one is tomorrow. And the meeting with Marla, and what we're doing in those meetings, our coalition meetings, is kind of discussing, having the same discussion you all are, which is trying to think about how and whether our process and our timeline aligns with Marla's,
Okay.
and then going back and scheduling a meeting with her and having a sit down, which will also just include the Office of Racial Equity and Social Justice. They'll be involved in those meetings as well.
Could we, I'm sorry, how often you said they're every week on what day?
Are you talking about our GI coalition?
Yes, ma'am.
They're not routine. So we meet every week and we decide at that current meeting what our next meeting is. We don't have a standing time because all of our partners do many different things in the community. So we meet and then we decide.
Could me and Justin be added to that, and then we can kind of rotate based on our availability?
Yeah, if you want to contact me offline, you both have my email and I'll.
I mean, because
I'll-
that'll be a way for us, 'cause this is not our wheelhouse, right? So this would be a way for us to be able to, at least, like you said, we're all talking the same thing.
Mhm.
In a
Yeah,
sense,
but I
and-
mean, if EHSD is the county organization that is
Mhm.
defining the parameters of this, we really Rachel, I 100% appreciate the energy and the education that you're bringing to this space. It's vital and it's what has brought us this far. And we're working within the county.
Right.
And if the Board of Supervisors is saying this is the department that is going to be making the recommendation, we also have to play within whatever parameters they're going to set. And so I don't know how much sense it makes for us to try to create parameters for them if they're going to say this is how we want to move forward and here's where your input can be received.
I agree.
That's my sentiment.
No,
So can
I
just-
definitely,
Sorry, can I just interject there? The board direction is pretty clear that the recommendation is coming. Yes, the county department, right? The home is in EHSD, but the collaboration on the plan is written in the board direction that it's a collaboration with the coalition. And I'll say, Marla has also been pretty upfront in terms of not being as well versed in the field of guaranteed income. She was not the one who came forward with the recommendation for guaranteed income, nor made the presentation on guaranteed income. So, our coalition is comprised of people who research, but also implement guaranteed income in the county. It's a really well-informed group of people. So we're working collaboratively with EHSD to come forward with that plan. And of course, they are the ones that will present, but it will probably also be a collaborative presentation as it was in October, on October 22nd. So it's a kind of a yes and to what you were just saying, Justin.
Great, thank you.
and I think for us, where I guess the question mark is still for me is when it came to the reentry part of it, it was as if we were to still move forward with EHSD. So it's in collaboration. It was like it was pulled separate in a sense. So that was one of the main reasons of me trying to figure out what Marla is actually doing in reference to the reentry for that 1 million, so that we can be part of that conversation in reference to how that's going to be structured. So that's what I'm hoping to find out on the 10th, because it seems like that is being doing separate. And I haven't received any communication for it, so I'm wanting to bring that back to, I just want to understand
Yeah.
and know and bring that back.
And maybe you can just send a meeting summary
Yeah.
following that ahead of our December meeting.
I will.
Okay.
I'm hoping that she can provide and share the documents that we looked at before, because that's what I really wanted, was to get my hands on what she presented to me in reference to what their ideas was, so that I can share that with you, and I didn't have that. So that was the reason for me requesting
Got it.
the call, that we can kind of go through that and go make recommendations on how we want that to be mapped out. But again, what I said earlier was my recommendation, because I felt like there was going to still be a gap if we just focus on those that are signed up for CalWorks. It's not going to solve what the gap that we identified.
Yeah.
So how do we pick the proper people that are receiving those benefits to actually get this funding, if that is the way that they're going to go with it? And that small group of folks is what I thought about.
Okay. Cool.
Oh, wow, my jabbering makes sense.
Okay.
Okay.
Any other staff or public comment?
Before we move on from the from the board supervisor
Yeah.
meetings, I was going to ask Patrice this, the next step for the gender responsive services. So the goal was to have this presentation in collaboration with the GI Coalition and EHSD. And then we thought at the December meeting for the board supervisors, then they would approve it's supposed to be, Jill, correct me if I'm wrong, an item that they would approve because we had the GI
Mhm.
and then we had general responsive services, but it seemed like at this meeting, everything just kind of got moved forward. So my next question for Patrice was, are we now going to move forward with the RFP process for the rest of the items under the pre and post release? Since we're still working on the GI. So Garyana, if you can ask her for that for me, for those other items under the priority number 4, are we moving into the next step for those? Or does
Yeah,
those have to go-
Nicole. Yeah, Nicole, my understanding is yes.
Okay, thank you.
GI was sort of held out for that further discussion, but all the rest is moving forward through ORJ.
Perfect. Thank you.
So then, Gariana, maybe we can change that question to an update from Patrice next month on timelines and status for those funding streams. Awesome, thank you. And CAB's involvement, maybe. Doug, I see your hand. Go ahead.
Hi, yes, good morning. This is Doug Leach with the Multi-Faith Action Coalition. And I just want to once again say thank you to the CAB and especially to this subcommittee for your hard work, not just on the possibility of a GI pilot, but of the whole package of the $15 million excess reserve funding. As for the GI in particular, I just want to applaud the discussion that just took place about a commitment to working very closely with the GI coalition, because they'd have tremendous resources and wisdom about how this is done elsewhere, and I think that's important input. So thank you for that approach.
Awesome. Thank you, Doug. Any other public comment or staff comment on Board of Supervisors? And then Doug, you still have your hand up, just to let you know. Great. We can move to the CAB policy and budget recommendations for 2025. So as discussed in the last meeting, due to the extensive research and engagement that we had over the past year, it was decided that we would utilize the recommendations for the excess funding as our guide rails for the 25-26 policy recommendations, policy and budget recommendations. So as you'll see on page 7 is a draft memo that outlines those 4 areas and reflects on the work that we did over the past year. In theory, this would be attached, Gariana, with the supplemental documents that we sent to CCP. So this was sent to you and Jeffrey for feedback.
That's fine.
Do you have any questions, comments?
I replied back to it and I was okay with what I always like when you write out things.
Great.
You captured all of it, so I didn't have any corrections or adjustments to make. I did have a question, and it may be just for me more of the timeline part, because in December, I believe that we're going to have a section where we'll have to kind of read this and give an update on what we written out here at the December CP meeting.
Okay, I'm happy to do that.
Okay. Oh yeah, that's your role. I did that last year.
There you go. It'll be short this
I
time.
just opened the floor and
Yeah.
then I passed it to Justin. I'm loving the handoff.
Yeah, awesome. Any staff comments or public comment? Awesome. And Jill, just a question, if you're still listening, like, is there any information that the policy and subcommittee could provide to the Board of Supervisors, or is this sufficient enough that they know what we're working on or are aware of our pathway forward? Maybe away from your desk. No worries.
No,
Great.
I'm here. I'm pondering your question.
So,
So this is for an annual report. Is that what this is for?
So we traditionally provide like recommendations year to year on areas
Yeah.
that they
Like
could
the
focus on.
ambassadors,
Correct.
right? So my experience with the ambassadors at our office is that, you know, they basically just introduce themselves and then a conversation starts. And then wherever that conversation goes, sort of is where it goes. And, from my review of the ambassador notes, I think it seems to be that way. It's great to have these for, I think, the newer members. And always good to have an overview. But I feel like we do less of reviewing all of these and hitting these points than just having a conversation. So I think,
Right.
having an outline to give to the members to help them, kind of focus their conversation is great. But I don't think this is the end all be all for information to the Board of Supervisors, if that makes
Wonderful.
sense.
Yep, totally. That's great. Thank you.
And usually what we also do when you read this is we still kind of type out and you don't have to, like last year, we kind of talk out, we can, if you want to, give an update in reference to like the access funds where we are. Sometimes we do give an update on what we received from an ambassador meeting. So if there are some key pointers that we got back from the folks we talked about, we can uplift those in there if we want to.
Yeah.
Or we can just keep it simple, cut and dry.
Well, I think we have to get this out for the timeline though, because when's the next CCP meeting?
Yes.
I
that's
think
It's
it's
mid-
tentatively scheduled for December 20th.
Yeah.
Yeah, it is. So if we need to, we have time. We don't have to, but if we need to, we can make some adjustments, or it could just be a talking point.
Yeah, I think
We already have this written out on what's going to be submitted,
yeah.
so there's no reason to adjust that. But if there's talking points that we want to go over, we can, if it's needed, just to kind of just want to give you that context. And that's what we did this year.
Awesome. Great. Any other?
Yeah,
Go ahead.
maybe we can write out, I'll probably write out something, because usually as the chair, because when Crawford was the chair, he starts off with his piece, in case there's some key things I may want to cover, and then go into what you wrote here. So I'll probably type something out ahead of time, just from the chair perspective. But won't dig into this.
Okay.
this part.
Awesome.
Okay.
Cool. Thanks for that. Okay, moving right forward. Wow. Moving right along or forward. Next is the H3 RFP, which is inclusive of some of the excess funding dollars.
So I had feedback on this. So I was very excited to see that it went out. And I read through it. Go to where it was. And I did bring this up to Patrice. Oh. Where is it? So one, and I don't know if you had a chance to read it. One of the parts that stood out to me on here was making sure that folks knew to apply for it. So I know that they added, and I didn't bring mine with me with my little highlights, so I'm sorry.
I'm talking about new program applications.
Okay, so on page 13 is where they have the new category for the new AB 109 prevention and diversion funding, right? So I'm very familiar with this application. For me, I didn't really see a breakdown of, I know they said other funding source, the available activities, eviction prevention, homeless rapid exit, and financial assistance. But there wasn't really an explanation of what we're looking for program, if that makes sense. So I'm hoping that they had a good turnaround in applicants that applied for this, that applicants knew to apply for it, because I didn't really see, as I read through it, more information about the AB 109 prevention, like how it's break down the capacity building and what that means and all that stuff in different categories. I didn't really see a section where it talked in depth a little bit about that. So I know the application's already out there. I'm pretty sure some good folks applied to it, but that was one thing that I did for myself. And knowing this application and how folks apply, hoping that we're not missing missing people. people that probably could apply for this. Let's see. So for example, if you go through, and it's already out there, it's just some key things for myself if we, do this again.
No, I hear what you're saying, and I appreciate you flagging that. I think,
Just look in this section here. And I'm on page, when I say look at this section, I'm on 4 and 5. Here's where they check up where they apply, but how would they know where to apply for the B109? It's on page 37 of the big document.
mhm.
Our mind is overthinking it because it says, please indicate what project type, new, renewal, expansion, capacity building. So in a nutshell, pretty much I would have loved if we had input or gave some, what was able to give some feedback. And I know
Yeah.
that was one of the things that we asked for.
So maybe that's a question, Ariana, that you can bring back to Patrice or Jill. Maybe you might have insight, but that was part of the recommendation for CAB, is to have some type of engagement or communication with departments as they're rolling out these RFPs. And what I'm assuming happened here is that they were in the process of rolling out a larger RFP and tried to expedite it and include it in here. But in thinking through that process, they're clearly not going to be able to make public documents that they're working on. And so like a subcommittee wouldn't be able to review that. So I don't know if this is flagging for like a larger county opportunity for process flow for engagement on these RFPs from boards that are working on parallel topics or are supporting these topics, because I align. It doesn't feel like the focus areas that were outlined in the proposal to CCP and the Board of Supervisors is as clearly noted here.
And to add to that, I know the reason of going this route, the reason behind it was good. I just thought it was going to be written out a little bit different.
Yeah.
So with the Measure X dollars, H3 had and forgive me if I get them, it was either RFP or RFQ, one of the two, where they individuals could request to be a housing provider on the list, which is a good idea. That was the reason why I brought it back to say, let's go through H3, because what they did is they were able to submit and review a list of housing providers that they already have on deck. So anytime funding comes in, they'll put this RFP, people can apply. And if you're already approved vendor, you have a better chance. So now we already have this bucket of housing providers that have been, and there's a lot of them. So when it was recommended to go this route, I'm like, that was a good idea, because they already had the pool of people. The part that I was confused on is when they submit, making sure, just with me being part of a lot of other steps, that people know where to and how to apply, because there's only one section in here that talked about the AB 109 monies of it. So if you're not familiar with that process, would you know how to submit your application? So I have feedback to them just about the application. I understood why they went this route, because there's already a ton of them in there. So I just had questions, and of course, because we're a subcommittee, we really could provide that feedback.
Yeah.
So is there a way of, could there have been a way of saying, hey, these are the questions that CAB had, or how do they include that in their process? So that was feedback that I did give to Patrice, and I know that you didn't have a chance to look at this, so didn't know if anything else stood out to you, but I wasn't sure. That was the first thing that stood out was, there was it was like it was there in one section, but I didn't see it anywhere else. And again, like I said, it could be because they're going to go based on that they have that group of housing providers already, and whoever applies and talk about the reentry part, that, what does that look like, I guess, is the question, because they're going to go based off the group of housing people that was already pre-approved. So it expands our housing provider list.
I think Patrice is the best one to answer as to the process of how this rolled out. I mean, I'm happy to pose some questions to H3 directly to kind of figure out how they're going to parse out that reentry population, which, of course, is the very specialized population that has been largely unserved, right?
Right.
So I'm happy to ask that question of H3, but Patrice could probably answer the questions on how this rolled out.
Yeah, we can add that, yeah, because I know she had a meeting with Christy and them to map this out.
Okay.
Um,
Because it
Yeah.
also doesn't look like all the funds are here.
right.
So then, do they have another RFP process that they're working on? Because didn't we allocate, I mean, some of
We
it's
did, but
core
this is, but
funding.
this is only, that one bullet. So
Yeah.
we had broken down in 3 sections. So the core part has already started. They have
Yeah.
already hired their staff, so that's up and running. This was the 1 million towards just the prevention and diversion
Mhm.
funding, and then there's one more left. I forgot what it was.
It was for actual housing.
Right, so that one is still in discussion, but that, I think
Got it.
having Patrice to come back and give an update, I know that she's been in meetings with Christy and them at H3.
Okay.
And for this part of it, the feedback I gave was the only information I knew before I kind of stepped down and share
Yeah.
in reference to how they were going to submit this, because they already had the pool of housing providers
Got it.
at H3. So we are pending that very last one. So I think at our next meeting, having an update from Patrice in reference to all of the priorities for the access funds will be great, because we also need to hear about behavioral health. An update on employment and the last priority for.
And employment's gonna take a while.
Uh-huh. But we haven't really got an update on that, so I think it'd be good to have her come back and
Yeah.
tell us, so that you know exactly what's happening with that.
It actually, thinking about next year, and maybe it's the February, yeah, we'll have to talk about a timeline.
Mhm.
But it's like, it probably makes sense to bring back the workforce board and HR
Mhm.
and yeah, it's the workforce board that's
Mhm.
doing the Cal Works employment,
In HR, yeah.
to have just a collaborative conversation here.
Okay.
But I don't know if that would be, that's probably next year, but I don't know if they're gonna roll that out before February and if that needs input before then. So I think, yeah, Gariana, I think the next step would be asking Patrice for a timeline update on all of the categories from the recommendation. And then maybe it's an honest conversation about where CAB is even able to actually put input
Right.
versus where our department's just gonna own this.
I think that's I think that's a good conversation to have, because I know at the CCP meeting, they were having that kind of discussion about the timeline. So I want to be able to, either you or I, when we're at those meetings, if they ask, we
Yeah.
can
Say,
really give a timeline, because I can't, or you can't, I can only give an update on what I know.
right,
And there's a couple of pieces that we don't know, because that's an RJ type of thing. So, and I think it's good to have it documented so that we have it. And how do we stay on top of that timeline? And I mean, the biggest question is like what you said is, where does our input come in and where does it drop off? And I know at one point, programs and services is going to have to monitor the programs, because that's not our piece.
yeah,
So that has to be part of it, is what does that actually look like, especially going into the new year, because it's going to be going into next year.
Yeah.
So I already gave programs and services, so they can know, like, this is going to be on your radar.
right.
You got to add this to what you're already doing with these new programs and stuff that we're working with, so.
Great. Any other staff or public comment on H3's RFP? And good luck to those applying. It looks like it's due pretty soon.
Yeah, I'm very excited about it.
Let's see.
Throw it out, so
There's-
it's moving.
Oh, it's
pretty-
not contracting until July 1.
Yeah, all of them are gonna be like that, because I know that the new contracts for AB 109 is coming up as well.
Mhm.
But again, Patrice can talk, because I'm not gonna say it properly. I know she gave an
That's
update
fine.
on that
Yeah,
last
yeah.
meeting, so let her explain how that timeline is. I don't want to misspeak for them, but I will say I'm excited about the core team. That has been working
Yeah,
really great.
that's awesome.
And I was able to meet their new staff member at a providers meeting, so that's been, they're even dropping people off at our CBOs. So that's working. Good.
Ooh, one thing to flag, Ariana, it says here, all proposals will be evaluated by a scoring committee made up of staff and lived experience of homelessness. Do you think we can add that they put someone who is AB 109 or previously AB 109 in that as well? At least for that subsection? That would be great.
So I know that they are reaching out, to see if, and I believe we should see some communication. They are reaching out to include, individual from CAPS that we can have voice.
Yeah.
on it. So,
That'd be great. Cool. Hearing no other comments, moving to item number 7, our next meeting. Does that work?
we have to change it because the CCP meeting is gonna be on that day.
Great.
And the funny part of it, about it was, I was actually available.
The
Go ahead, Jill.
the CCP meeting is later in the afternoon. You're looking at an afternoon.
Gonna be at, I thought I put, what's going on my calendar? It's supposed to be at 1, right, Jill?
Let me look real quick.
Thought I put on there, but I can't do both in one day.
Okay.
I'll have to take a whole day off for that.
What works for you then?
Yes, 1 o'clock is what I have.
I might not be able to make the next CAB meeting. Yikes.
Mondays work for you. I can do the 16th. The EC's on the 17th. I'm seeing budgets on the 19th. Tab on the 12th. What days do you have?
I'm pretty flexible. It's helpful to not do it the same week as CAB. The week of the 16th is fine.
You want to do that Monday?
Sure.
You prefer mornings or afternoons?
Let's do the afternoon.
Okay. Garyana, does the 16th work?
I can check to see if the room is available.
Okay.
If not, then I'll reach out to the subcommittee to find an alternate
Okay.
date.
Cool. Can
And
you
then we want to do the 1
1 to 3 or 1 to
Gotcha.
2:30,
1 to 2:30.
On the 16th.
please?
Okay, perfect.
All right. Any other questions or comments from staff or anyone on the call? Wonderful. Well, thank you all for showing up today and creating space for these dialogues. We appreciate your time. Enjoy the rest of your day and week.
Thank you.
You as well.